Okay, my name is Brittany. I'm a second-year FNP student at Radford University, Curling. Would it be okay if I do a musculoskeletal exam on you and record it for others to see?
Yes.
Okay, I'm going to go ahead and march my hands. Is it okay if I call you Randall?
That's fine.
Okay, I'm going to check your palpate, your team J. If you could open and close your mouth. Good. So he's not having any pain. You're not having tenderness in that, are you? And I didn't feel any kind of locking or clicking or anything like that, so his team J is moving well. Now, if you just don't let me open your mouth. Good, so that tells me his cranial nerve number 5 is intact. So next I'm going to go ahead and get you to open your jaw and move it side to side, and front and back. Good, so he's good range of motion in his jaw. So next I'm going to go ahead and get you to stand up, and I'm going to check your cervical, thoracic, and lumbar spine. So his spine is normal alignment, is in anatomic alignment. I don't see any kind of deviations from one side or the other, no obvious bulging or anything like that. So if you can go ahead and bend forward. Good, and back up. So I don't see any kind of obvious signs of scoliosis, lordosis, or lordosis, scoliosis, or kyphosis. It seems to be no obvious abnormals in curvature, normal curvature. So next I'm going to go ahead and palpate. Let me know if you have any pain.
No.
So no pain along the spinal route. He's not having his muscles appear to be firm around his spine. I don't notice any kind of swelling, no obvious bulging in one side or the other. So his muscles around his spine are good. So next I'm going to get you to face the camera and check your thoracic range of motion. So if you can bend forward and touch your toes. Good, and hyperextend back. Good, and lateral bend side to side. Good, and rotate, trying to keep your pelvis in the same position. Good. Next, if you can come and sit back down. So next, I'm going to check your cervical spine. If you can do chin to chest, chin to ceiling, rotate, chin, rotate, and then ear to ear. There you go. So that is good. Next to it, against resistance, against my hand. Good, and up. Good, inside. Good, inside. Good. So his range of motion in his cervical spine is good, and his muscle strength was a 5. Next, I'm going to start looking at his upper extremities. So they appear to be symmetrical. I don't notice any kind of gross deformities. One arm is not longer than the other. His shoulders appear to be symmetrical. Elbows appear to be symmetrical, and wrists appear to be symmetrical. No obvious deviations or bulging in any of the joints. I'm going to palpate him. Are you having any tenderness?
No.
So no tenderness, no swelling, no warmth, no nodules on the elbows. So that is good. Next, I'm going to look at his fingers. So his fingers are intact. He's got all 10. I don't notice any kind of nodules or swelling in his finger joints. They appear to be symmetrical. Next, I'm going to check his capillary refill. Good, it's less than 3 seconds. So you can go ahead. I'm going to check his range of motion in his shoulders. If you can raise your shoulders up and back down. Next, against resistance. So that tells me his cranial nerve number 11 is intact. Next, I'm going to check your range of motion. If you can just extend your arms up and all the way up and back all the way down. And then hyperextend back. Good, and back to normal. Then abduct out all the way up. And abduct in. And one arm at a time over across your body. And back. Another arm. And back. Okay, next I'm going to run you, do it against resistance. So lift your arms up to the front. Good. And don't push down. Good. And then out. Push against me. Good. Next I'm going to do you through passive range of motion. Let me know if you have any pain with this. Any pain?
No.
Okay. Check this one. Any pain?
No.
Any pain?
No.
Okay. So that is good. So next I'm going to go ahead and do your elbows. So if you can just flex and extend them. So that is good, symmetrical, no obvious problems in range of motion. Now if you could just pull against me and push against me. Good, so his muscle strength is a 5. If you can go ahead, I'm going to run you through passive range of motion. Let me know if you have any pain.
No. Nope.
All right, and next I'm going to check his wrist. So if you can just hyperextend and flex. Good, any pain with that?
Nope.
All right, I'm going to run you through passive range of motion.
Nope.
And then against resistance, so pull down, bend up, or just your wrist, There you go. Okay, now I'm going to get you to abduct all your fingers out and abduct them in. Then do thumb to finger, so good. And then finger to the 5th metatarsal, so that is good. Make a fist, good, and eversion in and eversion out, good. All right, so next I'm going to get you to squeeze my fingers, good. Can you pull against me? Try to extend your fingers. Good, and then extend your fingers. Don't let me try to push them in. Good, so that is good. good. You can put those down. So his passive and active range of motion in his wrist and fingers were the same, and his strength in his wrist and fingers were 5. So now I'm going to go ahead and look at his, check his sensation in his arms. Tell me what you feel.
Sharp. Dull. Sharp.
And what arm was that?
Right. Dull. Sharp. Dull. Sharp.
Good.
Left arm.
Good. All right, so next we're going to go ahead and check your reflexes. So first I'm going to start with your brachial reflex. Just try and relax. Then I'm going to do your tricep reflex. Good. And then I'm going to do your brachial radialis reflex. Good. Tricep reflex. Good. And bicep reflex. Good. And brachial radialis reflex. Just try and relax. Good. So that is good. Reflexes were +2. One other thing I want to do to check your range of motion in your wrist is supination and pronation. So that is good. All right, you can rest your arms down. Next, we're going to go ahead and look at his extremities and his legs. So his legs look symmetrical. One doesn't look longer than the other. I don't notice any kind of bulging in the knees, ankles, or hips. No pain on palpitation, no nodules, no redness, no warmth, no tenderness, or anything like that. So that looks good. Next, I'm going to go ahead and get him to lay on his back and check his range of motion. So if you can just lift your leg up to the ceiling, good. And knee to chest with this leg, good. And up to the ceiling with this leg, knee to chest, good. I push against my hands, good. Good. Now I'm going to walk you through range of motion. Let me know if you have any pain.
No.
Good. And bend down.
No.
No range of motion, no pain with that.
No.
Good. Abduct your leg out, one at a time, one at a time. All right, and this one against resistance. Good. And this one against resistance. Good. And then passive range of motion. All right, and then turn over on your belly. So his passive range of motion and his active range of motion were the same. He didn't have any pain with movement, and his muscle strength was a 5. If you can just lift your foot up to the ceiling, keep your left knee straight. Back down. This one. Back down. Now I'm going to do passive range of motion. Let me know if you have pain.
No. No.
All right, and turn back over. So passive range of motion is intact, active range of motion intact, muscle strength 5. So now if you can go ahead and stand up, we're going to check your knees. So just stand and face towards me. Okay, and hold on. So I want you to flex your knee back and then extend. Good. And then the other arm flex back and extend. Good. And then do it against, I'm going to run you through range of motion and tell me if you have any pain. Good.
No.
Good. Now let's do it against resistance. So don't let me lift, don't push down. Good. And this one? Push down. Good. All right, so his range of motion, active and passive, were good. You can have a seat. And his strength was a 5 and bilaterally. So next we're going to go ahead and check his feet. So if you can go ahead and dorsiflex your feet and plantar flex. Okay, good. And then inversion, eversion. Good. And then rotate. Good. So now I'm going to get you to do it against resistance. So pull up, push down. Good. So that was symmetrical, muscle strength of 5. So next I'm going to get you to extend your toes, curl them. Good. So that is his toes are good strength. So he has all 10 toes. I don't notice any kind of deformities or deviations or curvatures or anything in his toes. I'm going to palpate his Achilles tendons. It's symmetrical, no obvious increase in thickness, no tenderness, no obvious injuries. His capillary refill is less than 2 seconds on his toes. Next, I'm going to go ahead and check your reflexes. First, I'm going to start with Achilles. So I'm just going to check his Achilles reflex. That was good. Here we go again. That was good. Now relax. Go and check your patella reflex. Good. Good. So his deep tendon reflexes were +2 bilaterally. Tell me what you feel.
Sharp. Dull. Sharp. Sharp. Dull.
All right, if you can stand up. So when he stands up, he has normal position. His tibia and femur angle is less than 15 degrees. His weight is medial midline. He doesn't have any obvious deformities or curvatures in his toes. So that looks good. His feet look symmetrical when he's bearing weight and when he's non-weight bearing.